Hi, my name is Namrata. I have delivered baby boy in Columbia Asia Hospital, Sarjapur Road under the OBG doctor THEJASWINI. We are here to share feedback about the Columbia Asia Hospital, Sarjapur Road. He is my husband, Hari Prasad, would like to share with you.
Hi. So, when we visited Columbia Asia Hospital, we felt like we are in a hygienic and a safer place. So, during this COVID situation and the lockdown phase, the facilities like video conferencing and sample collections, blood sample collection from home physiotherapy and delivery of medicines to home, all this facility throughout the phase was very helpful, and it was very hygienic as well. And even during this phase, we had to visit hospital for consultation of Dr. Tejaswini. So whenever we came, we felt like they are taking extra precautions during this COVID and lockdown situations. So maybe when we enter the premises of hospital, so they do thorough screening. So they check body temperature using a non-contact thermometer, and they check about the travel history, they check about all the symptoms. And also when we enter the premises, they have non-contact sanitizers. They do deep cleaning activities as and when the patients vacate from the OPD consultation or the places where they are admitted. So the facilities whatever they are providing and the precautions whatever they are taking are extremely good. So, and also during the admission, so they keep the patients, especially the mother and baby, in a separate wing where the surgical patients are kept. And also the doctor and the staff nurse, whoever is entering the baby and mother's ward, they take extra precautions. They wear PPE kits, and they sanitize their hands, and also the materials or the medicines whatever is bought in, they'll be sanitized and will be very hygienic. And also the room is very spacious and well maintained, and they sanitize each and every corner of the room very frequently, which is very, very hygienic. And also they are capable of handling any kind of complications during the delivery. They have good specialists, and also they have very good equipments to handle the situation. And also so no matter whatever the situation during last week of the delivery or the last month of delivery, they are capable of handling all the situations. Also they are taking very good measures to maintain the social distancing in each and every corner of the hospital, may it be the pharmacy, may it be the cash counter, may it be the admission area, and the OPD consultation places, and each and every nook and corners of the building are well maintained, and they are maintaining the social distancing in a better manner. So what we both feel is Columbia Asia Hospital, Sarjapur Road is best place for delivery of baby, and both mother and baby will be safe and healthy. So thanks a lot for Columbia Asia Hospital, Sarjapur Road, for their facilities and the hygiene maintained during the place.
Hello everyone, I am Dr. THEJASWINI, gynecologist, Columbia Asia, Sarjapur Road. It has always been a blessing to deliver your bundle of joys and hand over those beautiful babies into your hands. But in the wake of current pandemic, such that even when they are having some problems also, they are hesitating to come to the hospitals, which is quite dangerous. So today I think that I'll take this opportunity to dispel all these doubts in your mind. We in Columbia Asia Sarjapur, we have implemented all ICMR and WHO protocols of social distancing, deep cleaning, sanitization and sterilization in outpatient procedure areas, inpatient areas, OTs, labor rooms, so that we have infection-free environment in all places at all times. And besides, we have separate floor dedicated for each specialties. Like we have a floor dedicated for OB, Gyn and pediatric, and then we have a separate floor dedicated for other surgical specialties, a separate floor for the people with other medical comorbidities like diabetes or hypertension or kidney diseases. And the beautiful thing is the air of each floor doesn't mix with each other. A lot of engineering and biomedical work went in achieving all these things, and we have staff also dedicated to each floor. And in the OTs also, we have a dedicated OT for OB-GYN work, and the surgical specialties have another dedicated OTs. And between two different procedures, we have a lot of deep cleaning happening in the OT, and then we have a lot of air changes which happens in the OTs in the labor room, so that we exhaust all the aerosols. and we keep the OT or the labor room sanitized and sterilized and ready for the next patient to come in, so that there is no infection. And besides, we being a multi-speciality hospital, we have all super specialists ready for any complications which can happen, because obstetrics, as you know, the patient comes walking into the hospitals and there can be anything which can going wrong with any pregnant woman. Like, we require so much of blood sometimes if there is any complications, so we have a dedicated blood bank which can give us the much needed blood at the need of hour. We have other different super specialists. Suppose a woman has any medical complication and she requires any ICU care. I mean, we need not shift the patient to any other hospital, because we have an in-house ICU and we have very trained intensivists and all who can take care of the woman. And even if the child has any problems, or if there is any extreme preterm also, we have a very good ICU backup where even extreme preemies can be taken care of. And if the child has any other medical problems, like any anomalies like a cleft lip, cleft palate, we have a army of surgical specialists, pediatric surgical specialists who can deal with the child. So all in all, I feel protected here to deliver my patient, because I know if I require any help, everything is in place, and it is infection free, and it is joy to work here because there's no infection, and then all infection care protocols are taken care of. Thank you.